South Africa is in the grip of a fourth COVID-19 wave, with infections rapidly increasing across the country. This has sparked fears of a stricter lockdown. The alcohol, tourism and restaurant industries say many businesses won't be able to survive should that happen. Some even argue that lockdowns haven't actually worked and have only damaged the economy. I'm now joined by a few people to discuss this. It's spokesperson for the Gauteng Premier, Vuyo Mhaga, public health medicine specialist Dr. Kerrin Begg, and Professor Mosa Moshabela, who's UKZN's College of Health Sciences, at UKZN's College of Health Sciences. Thank you all three for your time. We appreciate it. I think, Vuyo, let's start off with you. We do know that there have been some calls to possibly lock down the province only, given that over 80% of cases recorded come from Gauteng alone. How viable do you think it is for the province to be locked down again, considering this happened during the third wave?
Well, at the current moment, Heidi, we want support.
Vuyo, I think you're on mute. Okay, no, you're okay. Sorry, you can continue.
Yes, sorry about that. Now, I was saying at the moment we are really quite pleased that the president managed to keep the lockdown to level 1, because it obviously had a very devastating effect to the Gauteng economy. And I think a lot of things that we needed to put in place during the first and the second wave, we did put them in place, like, the bed availability, to increase the capacity of the bed availability in Gauteng. So we have always sent a message that we need to create a balance between livelihood as well as, the lives. And that balance, in particular in a province like Gauteng, is quite critical, because a lot of people migrate to Gauteng for economic reasons. And we must make sure that we don't then suffocate the economy out of it. But this is not to say it was not important before, because it was very important to make sure that we don't put much pressure in terms of the healthcare system. But in that process, we're actually building the capacity of the healthcare system, employing more healthcare workers, as well as increasing the number of availability of beds that are actually permanent. So anything eventuality now, we think that we are able to respond to it quite adequately. So the best solution at this given time is to make sure that we vaccinate more people.
Sure. Prof. Moshabela, maybe we can bring you in here. Many argued that last year, during the hard lockdown that the country went through, was a waste of time, because all it did was, what government said was, prepare hospital facilities to make sure that they were going to be able to deal with an influx of hospital admissions. Do you think that lockdowns actually work? Do they serve the purpose of stopping the spread of transmission and getting hospitals ready for a surge in infections?
Yeah, greetings, Heidi, and panelists and viewers. I think that is the main question, right? It's what we expect of lockdowns. So I think of lockdowns in terms of hard lockdowns and soft lockdowns. We are currently in more of a soft lockdown. And we also then have hard lockdowns. And from a public health perspective, we do lockdowns usually at a small scale to control our disease outbreaks. And the purpose of it is to limit mobility of people, so that, as we say, people, the virus doesn't move, we move it. So in order to slow down the spread, usually that does not slow down the spread completely. And what we've seen is that it doesn't necessarily reduce the total number of cases. It doesn't necessarily reduce the burden of death per se, but it slows it down, which is why we were talking about flattening the curve. What you do with the time that you have when you've slowed it down is up to you. That's a policy decision. So if it doesn't work once you've slowed it down, it's not so much that the mobility was not restricted. There's data to show that mobility was reduced, but it's more a question of, in that time, what is it that you managed to do and how you used the time that you've had. So I would say that if you understand the purpose of lockdown to be reducing mobility, during the hard lockdown, we did reduce mobility. There's data to support that. Then in terms of how you actually achieve reduction in cases as well as deaths, that depends on other interventions, not lockdown alone. You have to have other parts of intervention to make it work. Like we are saying, even in soft lockdown now, it's not going to be just about restrictions of movements that we have in level 1. It's going to be with a combination of masks, combination of restrictions on gatherings, etc. all of those things combined, they give you the benefit that you need to reduce the burden of disease.
Dr. Begg, maybe you can come in here and speak to us about what the science and data actually, what it says about lockdowns. Did they do what they were intended to do, to stop the spread of COVID-19, especially during the hard lockdown of level 5 and level 4. We're seeing Omicron a lot more transmissible, yet the President made the decision with the National Coronavirus Command Council not to place us in a level up, but rather to say the responsibility is on us as individuals to be careful and to vaccinate. But do you think, looking at the science and the data, that lockdowns, hard lockdowns that is, provided the necessary decisions or the necessary outcomes, rather, that government was hoping for?
So I think early on, hard lockdowns are really important, and that's what we showed early on. And exactly as Prof. Moshabela, a good colleague of mine, has said, is that it's all really dependent on what the purpose was. And the original purpose was to slow mobility and allow the health services to prepare for the possibility of significantly increased admissions. And certainly the evidence has shown that did in fact work. Once a disease becomes endemic, like COVID has become, then lockdowns become a very blunt instrument, and they don't really serve the purpose that they were originally created for. So they become less and less effective, and then we need to use much more finer-tuned instruments. And those become those restrictions on gatherings and those kinds of aspects that really reduce the number of people that can create a cluster that can stimulate swift spread. So the evidence does show some mixed evidence, but the evidence does show that lockdowns worked at the early stages of the epidemic. And I think we mustn't underestimate the effect that the alcohol bans had. And I realize that may not be a terribly popular thing to make, but we've certainly seen that the burden on our healthcare services was significantly reduced with the alcohol bans. And so, but that is a societal aspect that we've been dealing with for many years and long before COVID. And so that there really is a significant burden of disease in terms of trauma on our healthcare services, both on the use of the way we misuse alcohol in our country.
Yeah, I think that's a completely different topic, even though it has a direct impact on the burden it's placed on healthcare, especially during COVID. But Vuyo, let's bring you here in now, because we know that the Premier has been out campaigning, and he's saying that the solution here is for us to vaccinate. He says he doesn't want to take extreme measures such as a hard lockdown, especially in Gauteng, locking down the province. But just looking at how this province is the economic hub of the country and how there's so much movement in this province, and looking at how transmissible Omicron is, do you think that vaccination, the message of just vaccinating is the only option and no consideration of further restrictions should be considered?
No, we don't believe that there must be further restrictions. And I think both the doctor and the prof were quite correct. Is the issue, what did you do with the time that you were given to do the hard lockdown when the virus arrived? And I think I've alluded earlier that we need to make sure that we increase the capacity of the beds in Gauteng to around over 4,000 additional beds over that time. Now, what we need to then speak about is that let's encourage majority of people to go and vaccinate. That's why you then found the EXCO over the past week going door to door, trying to understand from the people why they are not vaccinated and trying to encourage them to go and do that particular vaccination, because we believe that we can't further suffocate the economy, in particular in Gauteng, because if Gauteng is not really responding economically, literally you have shut down the whole country. So you need to create that balance. So we are quite of the view that the current measures are sufficient. Ours is to further encouraging society, go door to door to them, speak to them, and make sure that you run the Vuma, project, explain to people really the importance, and also bring the data, because the data that started to show us now is that those people who are hospitalized are people that have not been vaccinated. And if you look at also the healthcare workers that we have lost in the previous waves and recently, you find that recently we've actually lost less healthcare workers. So this is the evidence that we are using to really further the message. So the message is simple. Let's make sure that people do vaccinate, because that's one current solution that we've got in our hands, and obviously continue with the non-pharmaceutical intervention that we've been speaking about.
Prof. Moshabela, what do you think about locking down or creating, I wouldn't want to use the word locking down, but creating further restrictions for the unvaccinated? This is what we're seeing in Europe. We're seeing in a large number of other countries to say, well, if you're not vaccinated, perhaps we should lock you down and create restrictions for you because you're unvaccinated.
Yeah, I think that in Europe they can do it because they've got a high coverage of vaccination already. So the people that are not vaccinated is a small minority relative to the ones that are vaccinated. In South Africa, it's the other way around. And so it doesn't really make sense. You have to think of these interventions as in stages. We are only still at a place where we can comfortably implement vaccine mandates. We're not yet at a place where we can actually start to lock down specific groups. We also don't necessarily have the systems to be able to implement that kind of an intervention at a scale that it would require, given the fact that only the minority, the people who are not vaccinated currently are still in the majority. So I don't think that we are at that stage. I think that, really the vaccine mandates is still our best option at the point that we are at, especially because we're really dealing with a lot of people that are vehemently against vaccination. These are mostly people that are hesitant. And that's it. You need a more kind of gentle approach with that group of people. Only when perhaps you're only left with people who are vehemently against vaccination can you then adopt such measures as only, as you say, selectively locking down those who are unvaccinated.
Sure. Dr. Begg, maybe we can ask you the same. Do you think that there should be restrictions and lockdowns for those that have opted not to take the vaccine?
So similar to Prof. Moshabela, I think that what we should be doing is saying that anybody who wants to attend gatherings should be vaccinated. And so permission for gatherings, permission for attending workplaces, for any environments where you're coming into contact with lots of people, that should be determined by your vaccination status. So difficult for us to police a vaccination lockdown where unvaccinateds are locked down, but we can certainly manage to only allow entry to particular environments of vaccinated individuals. So that is imminently doable and feasible, and that may just prod those who just actually haven't got around to vaccinating. They just haven't done it yet. They haven't seen a need to do it. They're not particularly phased either way, but if there's no pain, then they're not going to bother. And so I think that those are the areas that I think we can do a lot on now, using the much finer instruments rather than a very blunt hammer instrument of a hard lockdown. So those are the things that we can definitely do. But as we've seen with the Belito rage recently, that even vaccinateds can still spread. I think what's really encouraging, though, is that we aren't seeing the same slope of increase of admissions as we are seeing in this massive increase in admission in cases. So that's really encouraging, and that's really what we've been saying all along, is that we're not going to be stopping the waves, but what we are going to be stopping by vaccination is the admissions, the deaths. Certainly we haven't seen a ramp up yet in deaths since Omicron has been discovered, which is just incredibly good news. I mean, long may it last, and we wait to see over the next few weeks. But it really is good news that the slope of increase for admissions is distinctly lower than the slope of increase for cases. And that really should be encouraging everybody to just go and get vaccinated.
Sure. Vuyo, I want to bring you in here with regards to super spreaders. So many health experts, many within this space have indicated that sometimes hard lockdowns don't work. So, for example, last year we saw the beaches being shut down, which is in an open space, fresh air, and super spreaders are a big concern, especially in closed areas. And maybe this is something that government possibly could look at with regards to the spread, especially here in Gauteng, super spread events and indoors. What is the province's take on this? Vuyo, I think you're on mute.
What we are really encouraging.
Okay, great. Thank you.
Yes, sorry. I'm sorry about that.
No,
what we have obviously encouraged is to really manage, those areas of the super spreaders and all that. And if you really take it, if you remember last year, we were to really, when the nurses were just about to go and leave, thinking that there's a plague. In China, we then had an outbreak, and that would have been caused by the parties that were actually happening in and around that area. That actually triggered us to go back, including the matric dance that was happening in Durban. So a chunk of the students there were coming from that, from KZN, and started to really bring, the third wave earlier than not. So we are really encouraging the residents in Gauteng to make sure that, they don't have your massive house parties and all that kind of work. So if there are events, obviously try to make sure that they are in open spaces, so where there's a lot of ventilation. So we learn as the virus goes, what can we do more, and in terms of the fears around it, gets a bit limited, and we are able to sharpen our messaging to the residents of Gauteng. What more can we then do to make sure that we minimize the super spreaders?
Sure, but Vuyo, we've been in this for almost 2 years now, and we know how these variants work. We know how COVID works. Well, we think we do, especially when there's new variants, it becomes a little bit more tricky. But Professor Moshabela, maybe I can ask you what you think would be an ideal lockdown or ideal restrictions in the context of Omicron being so transmissible, but also in the context of the economic devastation that these lockdowns have brought about, and how our unemployment rate is at over 34%. What would be an ideal lockdown or an ideal restriction, if any at all?
Yeah, so I think if we put vaccination aside, Heidi, the management and control of infections and mild disease really rest with the population in terms of all the prevention measures that people have to adhere to. But I think when it comes to government, it's really more about managing severe disease and hospitalization and death, to reducing that. And so I can foresee a situation where perhaps if we start to see an increasing slope on hospitalization and death and severe disease with Omicron, then we might actually begin to think, is there a need for further restrictions or some type of lockdown? And especially if we find that there is now increasing burden on the health services, that they are not able to cope, then we may actually have to use restrictions to relieve pressure on the health services. I think for me, that's how I would look at it. When you do get into it, I do think that you can certainly look at regional restrictions, say by province, in order to make sure that you can actually just restrict mobility, restrict the spread, restrict the burden on the healthcare system. It'll take a couple of weeks before you can see the relief, but it may be worthwhile. I hope we don't get to that we're not going to see as much severe disease as that might actually put pressure on the health system.
Sure. And then, Dr. Begg, maybe we can ask you the same. What do you think would be an ideal lockdown or certain restrictions imposed in the context of Omicron, especially because we're seeing how those under the age of 19 and those under the age of 5 are being hospitalized?
So just a reminder that the hospitalizations that we see as we started to vaccinate the elderly initially, which was our priority because that was where we saw the most severe disease. So as they were vaccinated, so our admissions moved down in age groups. So it's not unusual that we should be seeing younger people being admitted now as we have larger proportions of the older population being vaccinated. So what we do need to be doing is getting our youngsters vaccinated as well, so that can also start to slow down our admission rates. In terms of restrictions, and I think that's more of an appropriate word than lockdowns, I think we should be focusing purely on watching what those admissions and death rates are looking like, because that guides us in terms of the pressures on our health services. But certainly what we should be doing is restricting large gatherings, and particularly any indoor gatherings. So we really should be focusing on the 3 C's, of avoiding the 3 C's of closed spaces, confined places, and crowded spaces. So just encourage everybody to really focus on being outdoors. There's really no sense in locking down things like beaches and outdoor parks and things like that, where we really would prefer people to be, but certainly look at restricting indoor gatherings and any large gatherings, and ensure that people adhere to the public health measures such as masking, keeping your distance, sanitizing, but most importantly, vaccinating.
Great. Thank you so much, all three of you, for that insight. That was spokesperson for the Gauteng Premier, Vuyo Mhaga, public health medicine specialist Dr. Kerrin Begg, and Professor Moshabela from UKZN's College of Health Sciences. Thank you all very much.